incredibly intense security around patient data is for frontline clinicians. To make an error with patient data, which we will call a HIPAA violation, it comes down to not just the healthcare system being fined, but it can go as severe as an individual clinician being fined for a HIPAA violation. So I think what technicians don't understand, or people in tech don't understand, is how intense that is ingrained to our experience as doctors. Like, you may not be irresponsible with patient data, and if you do, there are severe consequences. And so what I would say is, you want to know that A, the patient data is safe. You want to know that the tech company is using some of the same things that we use in the clinical setting to protect patient data, whether that's logging out of a screen pretty quickly after it's not active, or taking away the protected patient information so that anyone who's looking at the screen would not know who that patient was. You want to know that they're employing those things, because this patient data, it's not just data. And I think this is the thing that's sometimes hard for people outside of healthcare to grasp. These are people's lives. This is kind of the narrative arc of who they are, how they've suffered, how they've overcome the illnesses that they've experienced. You can't treat that lightly on a emotional level, on a cognitive level, and then on like an actual regulatory level as well. But I think really driving home that sense of this is precious. This is more than just someone's spending habits on Shopify. This is their life. And so I would say best practices involve making sure that the way that the healthcare company that is managing your data mimics the way that you think about it as an organization, as a healthcare